We told you about the National Guard deploying to help out hospitals across Georgia who have a labor shortage. And now we're getting fresh insight into the jobs they'll be performing. Channel 2's Mark Winnie got the rare access to one group deployed in Brunswick at our coast. He found out how they're helping in the fight against COVID and that Delta variant.
The Delta variant crisis is overwhelming. The hospital census today was the highest it's ever been, 278 patients. Usually at about 220, we're pretty full and busting at the seams.
Well, Mark, at the direction of the governor, we've deployed 100 members of the Georgia National Guard to 10 hospitals across the state.
How badly needed is this assistance from the Georgia National Guard?
Very badly needed.
Torrin Day says he works at a Forest Park physical therapy office in civilian life, but in the Georgia National Guard, he's Sergeant Torrin Day, combat medic, and he and 8 other Georgia Army Guard soldiers arrived at the Southeast Georgia Health System Hospital in Brunswick to combat the swelling COVID-19 crisis driven by the Delta variant. Reinforcements for the hospital's own men and women.
I just want people to know that we're here to help, and we're going to do everything that we can to make sure that we get through this pandemic together.
What you're seeing is not unique at all to this hospital.
Not at all.
Dr. Alan Brown says as the Southeast Georgia Health System's chief medical officer, he's very thankful for the Guard help because his men and women can use all the help they can get.
We're just so overwhelmed, and we could use 100 people, but obviously this is a welcome gift to our medical staff and our healthcare system.
We're assessing the situation and stand ready to respond to the governor's directive to provide more assistance if it's required.
Of the COVID patients that we have in the hospital, it's anywhere between 86 to 90% are unvaccinated.
Dr. Brown suggested his folks are overworked, overstressed, and frustrated that the current crisis could have been prevented.
We had 10 deaths in the healthcare system a couple of days ago in a 24-hour period. We've had to rent a morgue because there's just not enough space for expired patients in the community.
Georgia Guard Adjutant General Thomas Carden says his men and women deployed to 10 hospitals, including the one in Brunswick, have various medical skills, but the Guard has been careful not to pull folks out of civilian jobs where they were already fighting COVID.
We didn't pull these people out of hospitals, off ambulances, or out of nursing homes.
Dr. Brown says he's inspired by how the men and women in his hospital system are sacrificing and persevering for their patients despite everything that's happened surrounding this pandemic. In Brunswick, Mark Winnie, Channel 2 Action News.